Has your vet given you instructions following TPLO surgery on how to do passive range of motion, but there's no instructions on how to do it? Well, this video is for you. So when you do passive range of motion, the best way to do it is have your hand underneath where the stitches are and your hand underneath this bottom part of the leg. And all you're going to do is gently bring it towards their butt. And if you get to a point where it feels kind of tight or it just feels like, I don't know, don't go past that. Always err on the side of caution. Do less is always better than more. And I'm interrupting your sleep time. Stay there. And you're going to bring it back like this. And then with a count of 5, 1, 2, 3, 4. Now, in the first weeks, couple of weeks probably, you will not get full extension. That will be uncomfortable for your dog. So please don't force it. So if it only goes to here, no problem. And what you're going to find is you're going to do 10 repetitions. And by the time you get to the 10th repetition, your dog, you're going to get more range of motion, especially in extension, so away from the body. And 2 key points with this. One, as I mentioned, don't force anything. Actually, 3 key points to this. Number 1, as I mentioned, do not force anything. Number 2, do not do the bouncy thing. Don't do this. And number 3 is go slowly. So you want to count to 5 going that way and then coming back. 1, 2, 3, 4, 5. And 1, 2, 3, 4, 5. If your dog starts to pull away, it means you're either going too fast or too far. You can, if you really want to get, because they're not moving very much and they're staying in this kind of position here, you can also take the leg and do a little bit of hip extension. And again, slowly and back this way. And if you notice, I'm not gripping the leg like this, like I call this the death grip. I'm just gently allowing him to move his leg away from me if I'm going too fast or too slow. Now, if your dog does not tolerate this, one of the other ways that most of my clients seem to have success with is a dog that's used to a belly rub. So we rub the belly, rub, rub, rub. We can tickle the toes. They'll bend it. Oh, tickle, tickle, tickle. Good boy. And we give a treat always. And then some dogs, if we rub here, they'll start to extend this leg out. Oh, belly rub. Some dogs will roll over on their back and move all their legs, which is great if they do that. He's not one of those dogs. But typically, what I call this is tickle toes, rub thigh. And basically, it's the tickling of the foot. Sometimes you have to stick your finger right in there to get them. What you're doing actually is activating a reflex, which is not controlled by their head. They can't help it because it's a reflex. And they will only go as far as is comfortable with them. So that is tickle toes, rub thighs, or passive range of motion. Either way, as long as we're getting some movement of that leg, we're getting blood flow, we're helping remove any swelling, and it has to be comfortable for your dog.